Hey, I'm Dr. Kris. I'm here with my favorite therapist, Kindra Davis. Kindra and I have been working together, what?
10 years?
10 years at least. Kindra is definitely one of the number one reasons I got involved in therapy in general, and I'll let her introduce herself and give her credentials. But just the amazing things she and others were doing for my patients in my practice was just mind-blowing, and I'm so appreciative of it. So I got very involved on the therapy side, and what I wanted to do is throw a little video together here, answer some questions that people have had that have come at me as we've been doing some of the shorter form content, and like really bring in another expert to get like a more balanced viewpoint. So Kindra, introduce yourself.
Hello, I'm Kindra Davis. I'm a speech-language pathologist, a feeding specialist, and the clinical director at Dr. Kris's therapy practice. And I see infants as little as 2 days old all the way through some adults. And so we specialize in feeding, the musculature, helping to support any sort of structural stuff that might be going on.
Awesome. Well, let's just get after some questions. If you guys have more questions that don't get answered through our discussion, feel free to comment on them. I'll try to follow, and we'll try to answer some in some future videos. All right. First thing I want to clarify, I'm getting ready to go to the International Academy of Pediatric Dentistry annual meeting in Cape Town. I'm speaking on oral habits. We call them parafunctional habits or pernicious habits. And the question is, what's the difference between a parafunctional habit and a pernicious habit? I'll say this. In dentistry, if you suck your thumb, if you suck your shirt, if you tongue thrust, we call these parafunctional habits. What do you call them in therapy?
In therapy, we call them a pernicious habit. Pernicious means a habit that has a harmful effect in a gradual way. So, sucking your thumb doesn't immediately have a bad effect if you do it one day, right, or one time, but over time, gradually, it can totally impact your function of your oral structures. The same with chewing on a shirt, or chewing on a pencil, or sucking on a pacifier, or using a sippy cup. Those are all pernicious habits that, if used for long periods of time, can cause damage to the structures.
Yeah, and I don't know why we call them something different. Parafunctional habit is the term we use in dentistry, but if you hear them in therapy, you hear them in dentistry, it's basically talking about the same thing. If you're at my presentation, if you know me, you probably know that my big breakout moment that really went viral was the first video I did about this Soothie pacifier, right? This is the one they hand out in the hospital, the one that everybody has. A lot of lactation consultants and other people have clapped back at me in my comments section saying like, oh my gosh, the Soothie is so great, we love the Soothie. So when that was happening, I was asking Kindra, what's the deal with the Soothie? We're going to ask the same question. What's the deal with the Soothie? Why do therapists love the Soothie?
Okay, so a Soothie is a pacifier that has a very rounded shaped nipple, right? As far as palatal development goes, Dr. Kris really despises them.
That's true.
However, in therapy, if I'm meeting a baby who's coming in with difficulty feeding, and I'm evaluating the oral structures, evaluating the muscles, the tongue, the lips, and what's going on with all the structures, and I find that they can't cup their tongue. So the tongue should cup and wrap around the nipple of a bottle, of a breast, of a pacifier, whatever it is. But if the muscles of this specific baby don't wrap around to cup the nipple, then I actually like to use the Soothie to help stimulate that tongue cupping, because the tongue is going to wrap around the nipple of this pacifier. Typically that's about the only time I use them. The other things that can be helpful with the Soothie is that you can look into the actual back of the pacifier and you can see what's happening with the tongue. The tongue should move in what's called a peristaltic motion, a wave-like motion up against the palate to remove any liquid from a bottle nipple, a breast. And you can see that happening with the Soothie because you can look into the back of the pacifier and see that. The other thing about them is that you can use your finger in a Soothie. You can stick your finger in there and actually stimulate the tongue. So here's my little baby doll. You could stick your finger in and actually stimulate the tongue in a pattern to get that tongue moving. Now, there are other pacifiers out there, different than the Soothie, that are open in the back like that. But those are the times that I would use the Soothie. Or if we were really working on trying to teach a baby who has who doesn't have a nutritive suck, who isn't safe to swallow orally, or to accept foods or liquids orally, then I might use this pacifier to teach a non-nutritive suck, a suck that isn't for nutritional value, and then transition them from this to a bottle nipple that is a similar shape so that they're using those same sucking skills that they learned on this pacifier on the nipple that now is providing them with nutrition.
Okay, so I think I agree here that if you have feeding issues and you need to use a Soothie to build strength to do things for feeding, that trumps oral development, certainly in the early stages, right? Like, it's way more important that you can feed and you build that strength than you get the ideal palatal development, I would say. But to that point, there's like the Dr. Brown's is really popular, right? And they sell a bottle in this exact same shape. They also have this Soothie style pacifier, which is really a clone of the Philips Avent here. These, though, I haven't seen these transparent.
No, I haven't ever seen one that you can see through.
So it seems like transparent would be way better.
Yeah, and I think if you are using this type of pacifier, you teach the skill for it, and then you transition off of that pacifier as quickly as you can.
Okay. Could you just use the bottle nipple?
You could. The problem with that is when an infant is sucking on a bottle nipple that has holes in it, they're going to be sucking and swallowing air. So then they're going to have increased reflux, they're going to be more gassy, more fussy, and they may look like a colicky baby at that point.
Oh, that makes way more sense. All right. That's a great answer. If you have questions about the Soothie, you know why I dislike them, but you know why Kindra would use them in certain instances, and I support it. So let's get to our next question. Okay, so on the market lately, we've seen a lot of pacifiers come out that are much more, I guess, breast-like is how they're being advertised, so they're supposed to be physiologic in a different way than what we'd consider a normal physiologic pacifier, like a shape like this Nook that we would call physiologic, right? So this is the Ninico. It's super soft, got this small little tip on it. This is called the Passy. And something I noticed, I was just pointing out to Kindra, is that the Passy design is literally the nipple design off the Nook bottle top. So this is the Nook anti-colic bottle top, and this Passy is essentially a clone of the nipple style and shape. They're almost identical, which makes sense. What do you think about these? Have you seen people using these with much success yet?
I have. I like this one. I like that, again, it's open, it's transparent. You could get your finger in there. You could actually provide some stimulation and rhythm to the baby's tongue. So I like that one. I have seen families using it who like it pretty well. The wider, flatter nipples, I tend to recommend those if we have other structural issues going on. So if, for example, an infant has a restricted frenum under their tongue or a tongue tie, and they cannot elevate their tongue and compress up against the palate because the tongue is restricted and held low, then I might recommend a wider, flatter pacifier that allows them even a little more kind of bulbous, I guess, thicker from top to bottom, that allows them to do that compression in just an up and down motion instead of getting that full wave-like motion of compressing up against the palate. So I think some of those can be great pacifiers. I like this one too, this one specifically.
Yeah, that's a Nook for Nature, I think. Or maybe not the for Nature, but anyway.
I love the Nook ones because they also now incorporate this concavity in the bottom of the pacifier, which actually encourages the tongue to fit up into that spot. And instead of pressing the tongue low and it actually causing something that is holding a space between the tongue and the palate, it actually encourages the tongue to fit up into that little concavity in the pacifier nipple.
Yeah, I like that too. In fact, there's a couple, there's some Italian studies from the past 3-4 years that looked at babies and increasing their oxygenation. So they had babies come into this hospital that had respiratory problems, and they put them on pulse oximeters, which is basically checks your pulse and also tells your blood oxygenation. They found that when the kids had pacifiers in, they had increased blood oxygenation. And they also found in preemies that were using, they don't say which pacifier it is, and I actually reached out to the authors and they didn't answer me. So I can't say exactly which pacifier it is, but they mentioned specifically in the description that it has a concavity to bring the tongue up closer to the roof of the mouth. And in those cases, it actually improved jaw position also. So they put him in preemies, they had him suck on these, and then they found that the jaw position came forward and they used a measurement from the ear down to the chin. Then they went back 15 minutes later after they had removed the pacifier completely and found that that jaw position was still in a forward spot. So that's one that I've been thinking a lot about lately, just in terms of how cool this design is. And I was also thinking, to your point, like, if a kid's tongue-tied, they might still be able to cup, right? Because if they're held at the midline, they're going to cup, so they could get around this.
Yep.
But on a flatter pacifier, that might really expose that tongue tie if we can't get him up. And would be cool to see this one if you could actually see through the back, like all the way in, kind of more along the lines of this guy here, where you can really, really see in. This is a little more bulbous underneath, but is a pretty cool idea. I did see a kid just this week who's using this, started using this after we did a frenectomy on this kid, so released a tongue tie in this particular instance, and they had started using this afterwards, and they felt like they were building a lot of strength and the breastfeeding had improved. So
nice.
So take that for what it is, right? Okay, so when we're talking about pacifiers in infants, one of the things that comes up a lot is that they decrease SIDS, so sudden infant death syndrome, and they also increase blood oxygenation when they're using them, and improve jaw position when they're using and afterwards, if they're using a good anatomic shaped pacifier. And I always wondered, was that just because something's in their mouth, now they're nasal breathing? But there's a lot of questions being asked about that, like, no, kids need to breathe through their mouth if they have some sort of nasal occlusion. And I actually read another study, and I can't remember the source exactly, but they plugged kids' noses to see how quickly they could adapt to oral breathing. They found kids who were using pacifiers had a better ability to adapt from nasal breathing to oral breathing if they had some sort of nasal blockage, which is kind of interesting. Hard study to run, right? Because you got to take these infants and then plug their nose, and they quit plugging their noses as soon as the kids got too upset, because so they couldn't, like, torture babies the way they did, like, monkey studies. They would, like, plug their noses and stuff like that. We can't do that for obvious reasons. But my real question is, we believe that these can really improve breathing, and that's our goal with kids, right? We want to improve their breathing. Breathing is one of the most important functions in life, obviously. And if we're not breathing well, it can affect the way we grow. Our orofacial growth is largely impacted by our breathing patterns, particularly if we breathe through the mouth too much. So I always thought pacifier in, you're building good nasal breathing cycles. That might be part of it, but also it's improving jaw position. But we still get a lot of kids who have open mouth posture. They're breathing through their mouth. Parents will come to me and they're like, what do I do with my mouth breathing child? And I feel like you can't just say, tape the kid's mouth of, like, this little kid.
Right.
What would you do in therapy to answer that question?
So if I have a young kiddo who's coming in who is doing a lot of mouth breathing, there's a few things that we can work on. So one of the things might be to increase their awareness. I will teach kids, first, number one, is to blow their nose. Many kids don't know how to blow their nose. If they're congested, then of course they have to breathe through their mouth. We call that obligatory mouth breathing, because now they can't breathe through their nose. They have to breathe through their mouth. So one, I want to teach them to blow their nose. How is their nose? How clear is it? I have mamas will use for our tiny infants
The suction bulbs.
Suction bulbs. They make something now called a nose Frida that parents really love.
It's like with the electronic ones, or no?
Well, they do have an electronic one, but the nose Frida is
What
like
is
a
it?
long tube with a filter in it that they stick in the baby's nose, and then the mom
And then
actually
they suck
sucks
on it. Yeah,
the tube.
gnarly. Okay.
They didn't have that when my kids were little, but every parent I have ever known that uses it absolutely loves it. So,
Okay.
Those nose Fritas are great too, especially before a feeding, because babies have to breathe through their nose while they're either nursing at the breast or on a bottle. So that's, if they're a little bit older, then I'm wanting to teach how do we blow their nose. I will actually get a Kleenex and hold that in front of them and have them blow on it with their mouth. And then I ask them so we watch the Kleenex move and move and move. And then I say, now blow on it with your lips closed. So then they're using their nose to try to get the Kleenex to move. So just a little bit of air blowing on a Kleenex will get it to move. So that's how we start teaching them that's blow your nose. Then once we have our nose cleared, I'll do things with them like, let's hum a song. We hum with our mouth closed, so now we're nasal breathing. We'll do other activities. I might put them on a swing. We play games. And I'll say, as long as you're on the swing and as long as your lips are closed, you're breathing through your nose, I'll keep pushing you on the swing. But as soon as your mouth opens, I'm going to stop the swing. And then we're going to talk about, your mouth is open. You're breathing through your mouth. Let's go back to our nose. So we'll do things like that. The other thing is lots of increased awareness. So I will work with kids and I'll say, let's breathe like a dog, right? Right? Let's breathe like a monkey, right? All these different ways of breathing. Let's breathe like an owl, these long breathing. Now let's practice breathing like a butterfly. A butterfly is very silent, very quiet. We don't hear that breathing. And so now we've transitioned from these big mouth breathing. We've over-exaggerated the mouth breathing, how that looks, what that's like. And now let's go to a very quiet breathing. And we'll lay down on the floor and practice breathing through our nose. We will listen to different sounds of breathing through our nose. Cool. Really just kind of increasing that awareness of what is breathing through the nose and how do we make that happen. So that's some of the things that we do.
Oh, I like that. I mean, from a dentist perspective, obviously we care about the nasal breathing for growth and development, but also from just like a restorative or even like a hygiene perspective, right? If the kid has an open mouth posture, they're going to dry out their teeth. They're going to get more cavities. Mm-hmm. And every time I'll get families come in, I just don't know why my kid's getting all these cavities. Mm-hmm. You can see their dried out lips.
Gum issues too, right?
Yeah.
I've seen kiddos come in with really severely inflamed gums from
mouth
breathing.
Yes. And then also if you need to work on that kid, let's say you're using nitrous oxide, for example, and you put that nitrous on, and that kid can't breathe through their nose. I can't tell you how many kids in the practice, they're struggling, you put the nitrous on, you're like, oh my gosh, this kid won't calm down. You take the dental mirror, you put it in their mouth so you can see what you're going to do, and it immediately fogs. Mm-hmm. You don't fog a mirror if you're not breathing through your mouth.
Right.
Nasal breathing is not going to fog your mirror. So instantly you know, okay, well this kid's not really getting the nitrous, so they're not getting that benefit. So many reasons, but also really cool to know, if you don't realize this as a dentist, you can reach out to a therapist who can help you with these problems. You may not have time in practice to sit down and do the animal breathing game with your kid. Be like, okay, we're going to blow on this. Maybe you do in your practice. That would be amazing. But bringing somebody in with that expertise is awesome. And that's something we've been lucky to do, but highly recommend. Great answer. Thank you.
Sure.
Okay, we just talked briefly about how nasal breathing and helping a child nasal breathe can help you in the dental practice. And that's something that we can use the therapy group to help us with our patients. My question for Kindra is, what are some other things that come up in dentistry where therapy can really be beneficial?
Okay, so just having my own children and taking them to see the dentist and observing other kids that are around in the area. A lot of times kids have a hard time tipping backwards in the dental chair. Mm. And so as the chair starts to go back, they panic, they sit up, they cry. And so that's one of the things that a lot of therapists can work on. Occupational therapists can help. We call it gravitational insecurity. So the difficulty of knowing like what something is moving underneath of them, and they're nervous about that. It makes them uncomfortable. And so therapists can help with that. If you have a kiddo who has a really hard time sitting still, Dr. Kris oftentimes, and in a couple of the practices, has a weighted blanket. But almost every dentist has the weighted pad that goes on for x-rays.
Oh, yeah, the x-ray vest, yeah.
That is an excellent thing to help kids self-regulate and calm down a little bit. Therapies can help with that. Therapies can help with, so those are kind of things that maybe an occupational therapist might help with. If a child doesn't tolerate touch to the mouth, so if they get really upset, they don't like it when you touch, you can't clean their teeth, they have an overactive gag, those are all things that therapies can work on to help decrease that overactive gag, desensitize that, to help them learn to tolerate more touch to the mouth. And then, of course, in physical therapy, if we have a patient who is struggling with breathing or is mouth breathing, then oftentimes they're going to have a forward head posture. Mm-hmm. That posture opens up an airway. If you think about in CPR, what's the first thing they say? Tip the head back, pull the chin forward.
Yeah, chin thrust.
Yep. And so that, if you do that in an upright position, your eyes are always going to right to the horizon. As a human, we need to see what's coming towards us. Mm-hmm. And so if you do that in an upright position, now you have a forward head posture That can cause problems with the curvature in your neck. The curvature in your neck mirrors the curve in your lower spine. And so if we have that going on and we lose the curve in the neck, then we often will have lower back problems as well. So a physical therapist can help us with strengthening all of those muscles. They can look at, is the occlusion not coming together really well? Is it only occluding on one side? Is that causing a tension pattern or a weakness pattern in the rest of the muscles throughout the body? So those are just a few of the things. And then of course we have the speech therapy who can help with the feeding piece of it. In some places occupational therapists do feeding as well. So the feeding piece of it, looking at the function of the muscles and the structures, the tongue's ability to lateralize food to the posterior molars, the strength of the posterior tongue, that wave-like motion of the tongue, is that happening? Can they chew food, pull it together into what we call a bolus or a ball for a swallow? And are they able to do that? Can they get the food to the back molars for appropriate chewing? All of those things can be really helpful in the dental world. Also, if you have a tongue tie and the kid can't physically reach to clear the back teeth, we call that oral residue in the therapy world. Dentists have another crazy term for it.
Yeah, we call it oral toilet. I don't know if that term's still being used. I feel like when I was in training, it was oral toilet, right? The ability to clear your mouth.
Yes, so that can cause increased decay in those posterior molars and posterior teeth if the tongue can't physically get over there to clear the food out. So those are all things that therapies can help with.
Oh, and those are great because those are all issues that we are just constantly plagued with. What about a kid? I had a kid this morning who was just who chased everything with his tongue. Like everything I tried to do, I could barely work on because the tongue was everywhere. And I tried using device that isolate, people know that in dentistry, that kind of would shield and hold the tongue out of the way, and he just kept pushing. The thing's bending, he's pushing it into me. But would that be something I could send over?
For sure. I mean, that's something that a tolerance for touch to the mouth, right? If a kiddo is not liking the feel of something in their mouth and they need to get used to that and having more touch to the mouth, that's definitely something that therapies could help with and work on.
That's great. All right, hit us up with more questions as you have them, and we'll try to get some more content out for you guys. Thank you.